look at what's happening with hydroxychloroquine. Now remember, this is an anti-malarial drug which is hugely important in the fight against coronavirus, because even though it isn't a direct remedy for coronavirus, several doctors, including the Indian Council for Medical Research, have recommended this drug as a possible immunity builder, as a possible medicine you can take if you're coming in touch with patients who have coronavirus. Now, the moment Donald Trump said this, the moment the ICMR said it, people started going to pharmacies and buying this drug. Now, in the United States, one couple heard Donald Trump on TV. They had chloroquine. It wasn't chloroquine meant for humans. This was chloroquine meant for fish. They had that. The husband is dead. The wife is critical. And in India, too, it's flying off the shelves. This is not what people need to do. Take a look at this India Today ground report.
Both chloroquine and hydroxychloroquine, essential drugs to treat malaria, are flying off the shelves at pharmacies as coronavirus pandemic triggers panic buying.
बहुत सी दवाइयों का शॉर्टेज इन दिनों चल रहा है, जिसमें से एक दवा है हाइड्रोक्लोरोक्विन. उसकी भी बहुत सी शॉर्टेज है बिकॉज मैन्युफैक्चरर ने के पास एकदम से सडनली ऑर्डर्स आने स्टार्ट हुए हैं, और जो पहले के ऑर्डर्स थे वो ऑर्डर्स आज के डेट में उनके पास बहुत ज़्यादा होने की वजह से वो सप्लाई नहीं कर पा रहे हैं. ऑर्डर्स ज़्यादा है, सप्लाई उनकी उसके इक्वली नहीं कर पा रहे हैं, इस वजह से शॉर्टेज उत्पन्न हो रही है.
On 23rd March, the Indian Council of Medical Research cleared the use of the anti-malarial drug hydroxychloroquine as a preventive medicine for those facing high risk of the coronavirus infection.
Hydroxychloroquine dawa is recommended only for a healthcare worker who is treating a COVID patient. There is enough stocks in the country.
But the devil is in the detail. The ICMR made it very clear that the medicine has been cleared only for very specific cases. Healthcare professionals in a high-risk situation and caregivers for COVID-19 cases in isolation.
डॉक्टर्स वगैरह हैं, वो जितनी दवाई अवेलेबल थी हमारे पास वो सारी ले जा चुके हैं. इसके बाद अभी स्टॉक है नहीं.
ठीक है. That is the situation. People have been coming to buy this medicine in medical shops, but since it's a prescription-based medicine, can only be bought on a doctor's prescription.
The panic buying was triggered by a comment made by the US President Donald Trump, even though in the US doctors said hydroxychloroquine should not be used as a solution for the COVID-19 cases.
अगर ये दवाइयाँ मार्केट से ख़त्म हो गई तो जिनको ज़रूरत है असली उनको तो मिलेंगी नहीं, और जो आप घर में दबा के बैठ गए हैं वो बर्बाद हो जाएंगी.
The side effects include nausea, headache, depression, cramps, loss of eyesight in extreme cases. Doctors insist the medicine must only be taken under medical supervision when the side effects are also monitored. Bureau Report, India Today.
So I want to say it just once again, do not rush to a pharmacy to try and buy hydroxychloroquine. It may seem like it's a jugaad way, it doesn't work. There are people in the United States who are dead because they, in an ill-informed fashion, went out and bought the medicine. A doctor has to recommend it, and for heaven's sakes, leave it for those who need it the most. If you really need hydroxychloroquine, that's when you need to have it available. If everybody starts stocking it just in case, then that's a big problem. Now, one of the things that people have asked several questions about is the testing mechanism. How can someone get tested for coronavirus? How will that whole process work? How does that test operate? Do they take a blood test? Do they take a saliva test? So what we did is we sent our correspondent Maushmi Singh to one of the premier diagnostic laboratories. She spoke to doctors over there to try and bring together for you a full report on how the testing really works. Here is her report.
Is the second largest populated country in the world testing enough? Looking at the spine-chilling fatalities from countries like Italy, India has now decided to open testing of COVID-19 to private players.
प्राइवेट लैबोरेटरीज को हमने अप्रूव करना शुरू कर दिया है. उनमें से 22 जो लैब चेन्स हैं उनको हमने आज के तारीख पे उनको अप्रूव किया है. इन लैब्स की टोटल कलेक्शन सेंटर्स अगर हम देखें तो 15,500 कलेक्शन सेंटर्स सारे देश में फैले हुए हैं.
The testing rules for private players are clear. A prescription by a government doctor or a private doctor with proper credentials and a hospital stamp that says you need to be tested. An identity card is mandatory for a test by a private lab. A full disclosure form called Form 44 would need to be signed before the test. All private labs are mandated to collect samples from home and disclose results to Indian Council of Medical Research. So how much will testing by a private lab cost? The Indian Council of Medical Research has capped testing cost by private players to 4,500 rupees, an amount that is still far too expensive for a regular Aam Aadmi. There are also reports of false negatives in testing, with a few people testing negative only to test positive later. The virus needs time to manifest in the body, making it possible for a person to be a carrier and yet not test positive. Therefore, if one is quarantined and a suspect carrier and has tested negative, he might need to take another test on the 14th day of quarantine. In a country where there is only one doctor per 11,600 Indians, only one available hospital bed every 1,826 Indians, there are two big takeaways for our country. Stay home, India, stay alive. And test, and test more, India. Like your life depends on it. Bureau Report, India Today.
So that's how you can possibly get a test done. And the one message coming again and again from government, from the administration, is don't panic, stay at home. But there are lots of people who are clearly not paying attention, not listening in hard enough, because they're queuing up, violating all social distancing norms and trying to find some way of being able to stock up much more than they need. They're being complete COVIDiots. Shivarur shows you some of them.
With India in human history's biggest lockdown, enough of our chalta hai attitude. As India struggles to avoid the dreaded phase of community transmission of COVID-19, are we going to let corona villains dictate our fate? Not here on India Today, and that's why we present the Corona Villain Countdown, a reminder of what not to do as we fight this virus together. Let's begin. Kicking off the countdown is this group of people who are allowed to crowd near UP Chief Minister Yogi Adityanath, who led a Ram Mandir ritual in Ayodhya today. While strictures are in place for religious rituals, shouldn't there have been more control on the number of people at this ceremony, or if the ceremony itself could have been held off for the moment? Moving on to incidents across India of police excesses that have gone viral. In Khammam in Telangana, a lady doctor who was returning from duty last night was slapped and abused by ACP Ganesh. The incident has created outrage, with people demanding action against the policemen harassing persons attached to essential services. After US President Donald Trump said that these salts were effective in treating COVID-19, despite warnings from the ICMR that this is only for doctors to prescribe, India has also seen panic buying of anti-malarial chloroquine salts without prescriptions. We repeat here on India Today, with all the power at our command, this is dangerous and should not be done. Those buying or selling in this manner are putting lives at risk, especially of malaria patients who actually need it. A shocking case has emerged from Maharashtra, the state with the highest number of cases in India. On the day the entire nation observed the Janata curfew, a police official from Aurangabad arranged a big wedding for his daughter. Hundreds attended the marriage. A case has been registered. While panic is understandable, it still doesn't explain throwing social distancing to the wind, like at this vegetable market in Mumbai's Ville Parle. Despite curfew conditions, people have crowded out of their homes, leading to heated scenes with police shouting at them to go back home. There's only one true rule: don't be a corona villain. Stay home, stay safe, stay alive. Bureau Report, India Today.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel and don't forget to press the bell icon to stay updated.